Dr. Paul Marik exposes the truth about cancer treatment. According to Dr. Marik, only about 5% of all cancers are actually curable with chemotherapy. For the remaining 95%, chemotherapy is often just palliative, meaning it primarily aims to relieve symptoms rather than cure the disease, and it doesn't come without a cost. Chemotherapy can cause several severe side effects, including nausea and vomiting, hair loss, anemia, infections, bruising and bleeding, cognitive changes, sexual and reproductive issues, peripheral neuropathy, edema, suppression of bone marrow function, skin and nail changes. Check out Dr. Marik's video to dive deeper into this topic, and let me know your thoughts in the comment section below.
There are about 5% of all cancers that are actually curable with chemotherapy. So that's an important point to make. So what I'm not saying is no chemo at all, but there are certain tumors, such as testicular tumor, certain lymphomas, certain leukemias, choriocarcinoma. So there are certain tumors that are very chemo responsive, and patients can be cured with chemotherapy, but they make up about 5%. Chemotherapy is palliative at best. So what it does is it may prolong survival 1 or 2 months, but it does that at enormous cost to the patient, enormous suffering, enormous side effects, hair loss, nausea, vomiting, neutropenia. So what the chemo does is it goes for dividing cells. So it knocks out the bone marrow, so the patients become immune paresed and at risk of infection. It affects the dividing cells in the GI tract. So there's an enormous cost associated with chemotherapy in patients who have diseases that are not particularly chemo responsive. Chemotherapy is palliative rather than curative. And that's a very important question. So the patient must ask the oncologist, the chemotherapy that I'm getting, is this going to cure my cancer, or is it just going to palliate and extend my life a month or two with terrible side effects? And hopefully they'll be honest. So if you actually look over the last 30 years, this was a recently published study, despite the advances in chemotherapy, immunotherapy, surgical therapy, the life expectancy overall of a person with cancer has been extended 3.9 months.